Okay, I'd like to call the Committee on Rules to order. Please take the roll.
Senator Howe,
I'm here.
Senator Favola,
Present.
and Senator McPike.
Here.
You have a quorum, Madam Chair.
Thank you. Okay, what I'd like to do is to take up the JLARC studies and first. So Senator Reeves, I thought he was here. Senator Boysko. All these people sign up, they're not here. Senator, none of the JLARC people are here. Okay. Okay, let's go to, I'm looking at who's signed up here. Senator Servell.
Thank you, Madam Chairman, members of the committee. So Senate Joint Resolution number 10 is a bill that I'm calling my COVID autopsy bill. And it's basically a bill to set up a joint study of 10 legislators and about 14 other representatives of different interest groups, citizens, including K through 12, public hospitals or healthcare systems, representatives from Commerce and Trade, Education, Finance, HHR, Public Safety, et cetera, to basically take a look at what's happened over the last 2 years in our response, see what we did right, see what we did wrong, see what we need to keep, see what we need to get rid of. I think we need to look at the relationship between executive power, legislative power, how the state of emergency statute works, how our legal system worked, and then come back with recommendations in 2 years about how we could perhaps handle this better, learn some lessons from what happened. I've run it by JLARC, and they made some suggestions for the type of consultant we'd need to hire and the cost what would be, and there's a budget amendment in the Senate Finance Committee for that. I've also circulated through the executive branch. Of course, they just wanted to take it all over themselves. I told them that wasn't going to happen. Delegate Ware is carrying a companion identical resolution on the other side, and I think it's hopefully will be a good bipartisan look to get us some good feedback so we can take some lessons from what occurred. And I'm happy to answer any questions, but it's a pretty long and comprehensive resolution of a big, long and comprehensive problem that I think we need to take a peek at.
And the cost?
JLARC, I had originally put in the budget amendment, I was throwing around one for 200. JLARC told me that they thought we would need to spend about $750 to get a consultant with enough expertise and bandwidth to do the kind of review we need.
Was that Senator Norman?
Thank you, Madam Chairman. Senator Servell, did I understand it's a 2-year study?
Yes.
Understanding a little bit the compression issues with JLARC, is there any way this can be done in a 1-year study?
Well, this doesn't go to JLARC.
I'm sorry. Is there any way it can be done in a 1-year study?
And we could try, I guess. I thought it was such a big monster that I was worried about getting it all done in that kind of time frame because, we get out of here, at least it's only about 6 or 8 months, and given how many things it was looking at and the input that would be required, I thought that would really be pushing it. That's why I pushed for 2, or I put it in 2. But okay. You could always put it in for 1 and with an extension for 2 if we come back or something, I guess. But
Madam Chair, I'm sorry.
That's it. Madam Chairman, I wasn't asking to be argumentative on it. It's just with the velocity that these variants are moving. I just was wondering if it reasonably and comprehensively could be done within a year, that it might very well help us as I wish I could say with some confidence that we're not going to continue to deal with these variants, but I was just thinking as far as the utility of the product, but I'll certainly defer to the experts. Thank you, Madam Chairman.
Thank you, Senator Norman.
Excuse me.
Are there other questions? Senator
Madam Chair.
Peterson?
Yes, I would commend this study. I think 2 years is good. I think we actually need an extra year to kind of come out of it, first of all. And then secondly, I strongly support this commission. I think, needless to say, I have some very strong opinions. I know other people do. I think the executive power balance, the issue of access to the courts, the effect on and the rights of business owners, parents, it all needs to be factored in. I think what we've been through was historic, not necessarily in that it was historic and it was the first time we'd had an epidemic, but it was certainly historic and the first time we really reacted that way. So anyways, I commend this commission. So thanks.
Madam Chair.
Senator Marston?
Thank you. Having done this kind of work, we're not done with this pandemic yet at this point, and we're likely to be studying this while it's still rolling out and creating problems for us. What I would suggest to get at Senator Norman's point is that very often what's done in these circumstances is you have an interim report done at the end of the first year, and where you can put that to good use as you're still dealing with maybe dealing with some of the issues, and then the final report in 2 years.
Thank you.
Madam Chair, I also just note there's an interim report that's required after a year, so it's 2 reports.
Okay, are there individuals here to speak on this resolution? If so, if you could come forward and speak very briefly.
If you're in the Zoom room and wish to speak in regards to this bill, please raise your hand electronically now. Madam Chairman, we have no virtual speakers.
Hi, Michelle Gowdy from the Virginia Municipal League, also speaking for VACO. We support the bill and we thank the senator for making the change for the rural and urban communities. Thank you.
Thank you.
Julie Dime with the Hospital Association. We definitely support it and be happy to provide lots of information that we have learned over the past 2 years. We've also done a pretty thorough mid-after action report that we'd be happy to provide as well.
Thank you. Anyone in Zoom?
Madam Chairman, we have one speaker, Lisa Ramirez.
Ms. Ramirez?
Ms. Ramirez, please unmute and begin your testimony.
Good morning, and thanks for the opportunity to speak with you today. My name is Lisa Ramirez, and I'm the Senior Vice President of Community Impact for the YMCA of Greater Richmond. And we're here because we support this bill for a number of reasons. We understand that 80% of health outcomes are influenced by social determinants of health or the conditions in which people are born, grow, live, work, and age. Never has this been more obvious than over the last 2 years.
It's the wrong bill, Madam Chair.
I'm sorry.
I don't think she's testifying on this bill.
Are you testifying on Senate Joint Resolution 10?
I apologize. I don't have the number. I'm looking for the Joint Commission on Healthcare.
No, that's the wrong bill.
I apologize.
Thank you. Okay, so, okay, let's move on. We have Senate Joint Resolution 10, which has to, because of the fiscal impact, will need to go to finance. Is there a second?
Janet, you're on mute.
Madam
Senator
Chairman, it has been the policy that bills with fiscal impacts coming out of rules and only rules do not need to go to finance.
Okay, so, okay.
Fine with me. I mean, I don't.
So how are you going to fund this, Scott?
Well, there is a budget amendment in, and so I'm
So
sure I'll be
there is
dealing
a
with Madam
budget
Chairman on
amendment.
that. And
Okay.
yeah.
Okay, it's been moved and seconded that SJ 10 be reported. All those in favor, please say aye. Aye. Those opposed?
Recorded vote, I think, isn't it? Oh, all right.
Okay, thank you.
Okay, thanks.
Okay, go back to, what happened to my board? Oh, okay. I'd like to go back to the JLARC studies. Senator Reeves?
Thank you, Madam Chairman, members of the committee. You actually have two, one's the JLARC, and then I also have a bill that's a companion in case the JLARC study isn't picked up. There's a separate identical submission over in the House, and this is a result of the work that the Subcommittee on Charitable Gaming took up this summer. And what this would do would allow more focused oversight on all types of legal gaming in the Commonwealth and alleviate potential conflicts of interest. And some of what came out of the product of that subcommittee was we have about, where's my paperwork? 4 to 5 different silos of oversight for depending on the type of gaming. So lottery has casinos under it, HHR has its own, VDAX covers charitable gaming, you have online sports betting, and then some of the other things that are coming in. We don't really have an overall umbrella, and we had talked about the Virginia Gaming Commission, but what this bill does is kind of lays out that next level as we continue to clean up charitable gaming and the other ones come online and get their structure going and casinos start getting built, to set up some type of oversight over each of those regulatory authorities over those individual entities that oversight and kind of see. And so that's what this study would do. And if I may, Madam Chair, I put in Senate Joint Resolution 24 that if JLARC did not take up this study, that we could set up a joint subcommittee to take that up in earnest to try to get that before we come down and have a bunch of individual bills and try to make soup with a bunch of stuff, that we could get both the industries, all the players into that subcommittee if that be the will of this committee.
Senator Reeves, JLARC is currently under going a study of gaming oversight and can cover what you are trying to do with this resolution. And as well as your other resolution, I believe. Is Hal here? Yeah.
Good morning, Madam Chair, members of the committee. Hal Greer from JLARC. We were directed by the commission to undertake a study of gaming in Virginia. We're starting to do that right now, and it would cover the issues that Senator Reeves has in his study resolution.
Madam Chair, then I'd move to strike my bill and whatever you call it, the SJ 25.
Madam
Okay.
Chairman, maybe Senator Reeves would rather have it carried over while they do the study, and that would leave him as not striking it.
That'd be fine too. Thank you, Senator McDougal.
Carry over for the year.
Okay, it's been moved and seconded that we carry over SJ 25. All in favor, please say aye. Aye. All those opposed.
And 24, okay. Madam Chair.
And he also has SJ 24. Is there a motion to carry that over as well? It's been moved and seconded that SJ 24 be carried over. All those in favor, please say aye. Aye. Those opposed.
Thank you, Madam Chair.
Thank you, Senator Reeves. Senator McClellan, you have SJ 33.
Yes, ma'am. And I also have a line amendment. Do you want to take that first, or you want me to just present?
I have a question for you. JLARC did this same study of election governance in 2018. What's different about what you're asking for now?
Well, I was not aware they had done that, but specifically with the amendment, it asks that JLARC also study the funding levels provided by the state and localities respectively to cover election, the conduct of elections. I don't know if that was included in the JLARC study. The idea here is for JLARC to look at the specific roles and responsibilities of the state and local elected officials in the conduct of elections and review the accountability structure. Because while state law says that the Board of Elections and the Department of Elections are sort of provide oversight to the local registrars and local electoral boards, there really is no true oversight or a way to hold them accountable if they do something wrong or do something inefficient. I was not aware of the 2018 study, so I can't tell you what that study specifically looked at.
Hal, can you address that?
Madam Chair, members of the committee, we did a study. It was a broader study in 2018. One of the things we covered was election governance. Some of the issues that Senator McClellan has identified in her resolution were not the focus of our study, so there would be some differences between what we did, but there would be some overlap as well.
And Madam Chair, I'd be happy to amend it so that we remove anything that has already been studied and limit it to just those items that were not included in the previous study.
Okay, can we carry this by for the week and you determine what was done previously and amend it so that we can determine, so we won't be doing any overlap?
Yes, ma'am.
Okay, thank you. Senator Boysko, SJ 27.
Thank you, Madam Chair. First of all, I have an amendment. Hal Greer of JLARC has asked that I amend the resolution to see if perhaps we could look at 2023 for the study as opposed to doing it this year.
Okay, so can we have a motion on that amendment? I need a second. Okay. It's been moved and seconded that we amend this study to be conducted in 2023. All those in favor, please say aye. Aye. Can y'all wake up? Those opposed? Okay, thank you.
Ready?
Okay.
Madam Chair.
Thank you, Madam Chair. SJ 27 would address the Judicial Inquiry and Research Commission. And I believe that it would do something to help our Commonwealth with transparent and more effective oversight. In 2021, the JERC reported 395 complaints were filed alleging legal malpractice or unethical behavior by members of the judiciary. 371 of these were dismissed because they were not within the Commission's jurisdiction or failed to state a violation of the judicial canons of conduct. And I understand that that's part of their charge. Five complaints were dismissed despite evidence that the canons were being breached. And moreover, the instances of judges being held accountable are sparse, leading to a perception of some of the general public seeing a bias here. SJ 27 would direct the JLARC to consider several major aspects of the JERC, including its procedures and the number of qualifications of its members. With this information, JLARC will provide recommendations that will facilitate mechanisms for accountability, transparency, increased efficiency, and eliminate actual or perceived biases in the JERC. More importantly, SJ 27 will serve as an important first step in bringing a more streamlined and efficient legal system in the Commonwealth of Virginia. I have heard from judges, I have heard from attorneys who say they believe that this is a valuable exercise. I could answer other questions if you wish, but that's my bill.
Senator McDougal's voice I heard first, and then
Madam
Senator
Chair, this is a question I'm not 100% sure I know the answer to. We nominate members to JLARC, but is JLARC not in the judicial branch? And so my question would be, JERC, is JERC not in the judicial branch? Could JLARC do a review of a entity that's in that separate branch of government? And would they have to comply?
Madam Chair, would you like me to share with you, or is that a?
They review the executive branch.
Madam Chair, my understanding is in the statute in Virginia Code 17.1-900, there's no specific request of qualifications for membership in the commission or any training that they must receive before serving. The guidelines in our code, which we are overseeing, for how they must carry out their duties is limited. They are authorized to hire staff in the code 17.1903, but the code doesn't specify what powers or duties may be delegated to staff, except for disqualifications due to being subject of a JERC investigation. The JERC chapter of the code says nothing about the conflicts of interest for the commission members or staff, or when a commissioner or a staff ought to recuse himself due to bias. Most of the Virginia Code chapter on JERC discusses formal disciplinary procedures. There are almost no guidelines for informal discipline or so-called supervisory agreements between the JERC and a judge. That amount is to any sort of informal discipline. And if the JERC enters into a supervisory agreement or informal discipline, then its investigation and disciplinary actions remain completely confidential. Lastly, the mandate of the JERC may be too narrow. The Virginia Code 17.1902 states that the powers and duties of the JERC is to investigate charges arising out of the present or any prior term of office, which would be the bias for retirement, censure, or removal of a judge, under Article 6, Section 10 of the Constitution of Virginia. Virginia does not, there are questions from attorneys and others who have raised patterns of misconduct, poor temperament, and problematic decision-making. And in Virginia Code 17.100, the program is operated by the Supreme Court, as you said, and it has stated the purpose for providing self-improvement for a mechanism for judges as a source of information. So the JERC doesn't have any access to what the Supreme Court's process is doing. That's another question that's been raised here. So I just thought I would bring this up, to share with you what has been shared with me.
Madam Chairman.
Mr. Norman.
Thank you very much. Many of us in the profession are very familiar with JERC. And yes, there are statutory provisions that are there. Historically, JERC has been given a lot of latitude, and there are some amorphous definitions in there. And that has been done with the previous intent of trying to protect the reputation of judges that might be exonerated from it. That statement does not preclude that we shouldn't examine it. I would remind the body that the appointments to JERC come both from the administration and from the General Assembly. So when we talk in terms about qualifications or insight, we bear, as the General Assembly, bear some of that responsibility on it, and I would be concerned about articulating too strictly what qualifications might be. You talk about bias or influence on it. I think one of the potential improvements that could come under Senator Bosco's study is that it's disturbing to some of us, even in the profession, where an attorney may initiate or a citizen complaint against a judge, and there is never any acknowledgement or revelation as to what the disposition of it is. And that was the case with a very controversial judge who previously had been the chairman of the Parole Commission on that I know that one of our citizen members of the General Assembly initiated a complaint and could not find out what the disposition of it was. Another thing on influencing, or if they have a bias, there was a situation that arose under that same judge where the governor's private attorney actually approached the Jerk Commission on the date of a hearing and tried to disqualify a majority of the members of the commission so that they could not consider the disciplinary action against that judge on that particular day. The fact that that attorney, when a complaint was noted, subsequently lateral it off to another attorney of his selection, that is the type of bias and interference that I think we need to try to protect against. Thank you, Madam Chairman.
Thank you, Senator Norman. Are there other questions to the patron?
Madam Chair.
Senator Peterson.
I want to commend Senator Boysko for this. I think this is an excellent idea. I've practiced for 28 years. Jerk has always been a black box to me as a practitioner. I've tried to avoid, frankly, referring clients to it, or I've really never interacted with it myself. I have come across occasions where judges acted in a way that not was just illegal, but in some case physically harmful. I can give an example of a client that had refused to sign a quitclaim deed for her own marital property, which she had no legal responsibility to sign. The judge ordered her to sign it, did not give her a chance to obtain counsel, did not even have a court reporter present, and held her in contempt and put her in the county jail. And by the way, that judge will be coming back up to be renominated as a substitute judge, and she'll be here. I just say that there are instances where people can be powerless in front of a judge, and Jerk should be a chance for them to have a forum, and so I support this legislation.
Thank you.
My thing just went out. Are there those here in support of SJ 27? And if you could be brief, please.
Morning, Madam Chair, members of the committee. I just want to touch on something that some of the other attorneys, Michael McMillan with Justice Forward, I'm here in support of this study, that some of the other attorneys have brought up. There hasn't been a formal disciplinary action taken by Jerk in over 5 years. That leads to a situation where an attorney may have more fear that they will get retribution in the courtroom or have retribution come to their client for filing a complaint than they would have faith in Jerk addressing even a significant issue. The only other process that our code or constitution allows for oversight of judges is impeachment, which hasn't been used in over 113 years. We've seen at some of the hearings, even this session, that sometimes the renomination process, when there are serious issues with the judge, it's sometimes too late at that point, and the discussions here in the body can sometimes not be the most productive way to correct action by judges that are maybe not living up to the judicial canon. So we urge you to support this. There are a number of best practices that other states do with these things. There are national study groups that have looked at these things. We're hopeful that the Jerk Committee can be improved after this study. Thank you.
Thank you. Others in support?
If you are in the Zoom room and wish to speak in support of this legislation, please raise your hand electronically now. Madam Chairman, we have no virtual speakers.
Is there opposition?
If you are in the Zoom room and wish to speak in opposition to this bill, please raise your hand electronically now. Madam Chairman, we have no speakers.
Okay, we have SJ 27 in front of us. It's been moved and seconded that SJ 27 be reported. All those in favor, please say aye. Aye.
Aye.
Aye.
Those opposed? Thank you, Senator.
Thank you, ma'am.
Okay, that completes the JLARC studies. Now I'll go to those who have signed up. Senator DeStefs.
Madam Chair, members of the committee, thank you very much. We're going to talk today about Senate Joint or Senate Study, Joint Study 37. And what this is having the State Board of Elections working group study and develop initial instructions and procedures that would consider electronic ballots for deployed military. And an example of this was that just this year we had our astronauts vote from space in Texas, and their votes counted in the last election. Also in Texas, Alaska, and a few other states, our deployed military are already doing this. They're already voting electronically. And what I wanted to do with this study was actually look at this again. We looked at it maybe 6 years ago, and at that point in time, the groups couldn't agree with a common approach. With the technology today and the things that move forward, I'm certain that we may have a different outcome this time. And Madam Chair, members of the committee, that's what we're asking to do. I'm sure there'll be at least one against this, which is verified voting. They're usually against this kind of action.
Okay, are there questions to the patron? Okay. Those in support?
If you are in the Zoom room and wish to speak in support of this bill, please raise your hand electronically now. Madam Chairman, we have no virtual speakers.
Those in opposition? Okay.
Yes, as predicted, I am Dr. Audrey Malagon. I'm professor of mathematics at Virginia Wesleyan University, but I am here today on behalf of Verified Voting. So, Madam Chair, thank you for the opportunity to speak. Verified Voting is a nonprofit, nonpartisan organization that focuses on election security and technology. We oppose this resolution, in my professional opinion, and that of the nation's top cybersecurity experts. There's simply no way to transfer our deployed soldiers' votes over the internet without compromising either their secrecy or their privacy. The pilots that Senator DeStuff mentioned, Alaska did attempt a web portal, but they have since closed it. Pilots in other states have used systems that have then later been found to have serious security vulnerabilities. It's important to keep in mind that voting online is not like many of the other things we do online, including banking. My bank account is tied to my identity, so I can verify that the amount in there is correct. But if I'm voting without a paper record to go back to, there's no way to verify that the vote that I cast is actually the same vote that is received and counted by the election office. And if the voting system is compromised in any way, there's no paper recovery plan to go back to get an outcome. This is the reason that Virginia eliminated touchscreen voting machines that didn't have a paper trail. We have already spent time and money studying this issue. I know Senator DeStuff mentioned recent technology, but even as recently as 2020 and 2021, national organizations, the Department of Homeland Security, FBI, the Cybersecurity Infrastructure Security Agency, all have recent reports that recognize that our technology cannot do this, even with advances like blockchain. There just is not a secure way to protect voters' privacy and ensure their ballot is recorded accurately. Perhaps NASA, with its unlimited resources, or very seeming unlimited resources, can provide secure computers to send something back, but we can't rely on individual phones that could be clogged with malware to do this. Opening up an internet attack surface right now just seems like a really dangerous idea given the election climate. We don't want to shake voter confidence or put our potentially an entire election at risk given some of the narrow margins that we've seen. So I just will say we all want to make voting more efficient and more accessible, especially for the military. There are multiple programs in place that do this. You can receive a blank ballot electronically. You can have a special Department of Defense return label to return your ballot by mail. These are prioritized for processing. The Federal Voting Assistance Program just released its 2020 report to Congress, and they reported it was about 5.8 working days to get the ballot back to the election office. So we're a leader, Virginians, in election security. Please, I urge you to not spend more of our state's resources investigating methods that we know compromise the security of the votes of those that are fighting for our freedoms. Thank you.
Madam Chair, members of the committee, for those military members who request an absentee ballot, about 30% of them arrive back on time. And again, I believe that if NASA can do it, we can figure out how to do it as well.
Thank you, Senator DeStuff. Okay, is there anyone to speak against it?
If you are in the Zoom room and wish to speak in opposition to this bill, please raise your hand electronically now. Madam Chairman, we have one speaker, Lisa Gerchik.
Thank you. If you would speak briefly, please.
Ms. Gerchik, please unmute and begin your testimony. Ms. Gertruck, please begin your testimony.
Madam Chair, clearly
Okay.
she's not using NASA's technology with Zoom today.
Thank you, Madam Chair.
Yes.
My name is Lisa Cotian-Gerchik, and I'm here to speak on behalf of the League of Women Voters of Virginia. The League opposes SJ 37. Allowing military and overseas voters to cast their ballots online is a compelling goal to help their ballots arrive on time. Unfortunately, online voting cannot be adequately secured for governmental elections. The Department of Homeland Security, the FBI, NIST, the Senate Select Committee on Intelligence, and the National Academies of Science, Engineering, and Medicine have all rejected online voting. Military and overseas voters are already able to receive their ballots electronically. Virginia has a 45-day early voting period. In addition, a ballot sent by close of polls has until noon on the third day after the election to arrive and be counted. That's 51 and a half days. The military has published data showing that this is more than enough time for a ballot to arrive from even remote military installations. On average, it's about 14 days. We assume that a study would find that no security and encryption measures would guarantee the accuracy and integrity of voted military overseas ballots required by this resolution. Therefore, the League opposes spending taxpayer dollars on the proposed study. Thank you.
Thank you.
Madam Chairman, that is all of the virtual speakers.
Thank you. If you could wrap it up, Senator.
That's it. That's all I got, Madam Chair.
Okay. Okay, we have SJ 37 before us. It's been moved and seconded that SJ 37 be passed by indefinitely. All those in favor, please say aye. Aye. Those opposed?
Aye.
Those opposed?
Madam Chair, members of the committee, thank you very much. Have a wonderful day today.
Thank you, Senator DeSette. Senator Norman? And Senator, please note Senator Norman's abstention. Thank you. Senator Sudalan.
Thank you, Madam Chair. I've got Senate Joint Resolution 42 for your consideration.
Okay.
The resolution asks the Joint Commission on Healthcare to look at the benefits of Virginia hospital and healthcare providers addressing patient social determinants of health. That's what the bill does, and the reason why we want to do it is because of the significant benefits that we think could come to Virginians, and also as we spend Medicaid dollars providing services that are better. This has been something that we've had some success, or I shouldn't say some, we've had a great amount of success in Roanoke, at Carilion, through some of these programs, reducing the likelihood of emergency department visits to the hospital for chronic diseases, the sorts of things that we would not want them going there for, and where they can get services better. There's a wide variety of programs in other states across the union that have done this, including North Carolina, Nebraska, Florida, Kansas, Pennsylvania, and Michigan. And this would be the study to then further see how we can do this before we pursue federal options. And this is something that I was asked to look into by our friends with the hospitals, something that at Carilion I've heard from a lot in the past, but also hospitals across the Commonwealth. And I think that Julie Dime is the representative from the Hospital Association today who would like to share why hospitals across the Commonwealth believe this is something that we could do to better serve Virginians and also better serve taxpayers in the process.
Good morning, Madam Chair, members of the committee. Julie Dime with the Hospital and Healthcare Association. And I think Senator Suderline did a great job of explaining why this is necessary. I just want to give you an example of something that we would find very beneficial to know. We do have folks who come into our emergency department. Particularly, there was an elderly couple in Southwest who continually came in about halfway through the month. And what we determined and what we were able to understand is that they were sharing their medication. And unfortunately, about halfway through the month, they would come back to the hospital because they would run out. So with these type of identifiers, we can figure out that is a lack of being able to afford their medication, and those are things that we can help with in providing resources in the community if we know them and if we're able to direct that care. So that is just one example. There are several others of why someone comes. We know that 70% of our high utilizers that do utilize the emergency department have a mental health challenge, also either additional medical challenges, but they oftentimes have a social challenge as well. If we can solve one of those problems, we can get to the other and then get to the other. So we really think this is something that will help us be able to reduce costs by not having the overutilization of the emergency department. And I would just quickly like to thank Senator Barker, who's been a leader in this area in trying to get us to look at other solutions that we can offer patients besides coming to the emergency room, which is by far the most expensive place to receive care.
Thank you.
Sure.
Anyone else here in support? Anyone in opposition? Okay. Real quickly, please.
Hi, Kelsey Wilkinson, Medical Society of Virginia. We thank the patron of the VHHA and we support the bill.
Anyone here in opposition? Okay.
Madam Chairman, we have a couple individuals on Zoom that would wish to speak.
Okay, if you could speak very quickly to this.
Samantha Adelberg, please unmute and begin your testimony.
Thank you so much. I want to thank you for the opportunity to speak. My name is Samantha Adelberg, and I'm speaking on behalf of Unite Us, a technology company that's focused on providing end-to-end solutions that address social determinants of health. We support this study bill for a number of reasons. I think first and foremost, we know that over 80% of health outcomes are influenced by the social determinants of health, or the conditions in which people are born, grow, live, work, and age. And in this context, it's essential that we understand the specific impact that non-clinical social needs of health have on our communities and our health systems in Virginia. This will allow us to strategically invest in the health-related services that can address and mitigate these issues upstream. A better understanding of social needs and services that are demanded across the state can also help the Virginia provide targeted resources towards impactful solutions. Unite Virginia, which is the state's coordinated care network, provides an excellent example of how infrastructure like this, which already connects hospitals, health systems, providers, and community organizations together in a single network, is already starting to address the social determinants of health. And we've seen tremendous benefits since December 2020, when the network launched. We've seen increased access to care for individuals. We've seen frontline staff who are empowered to provide stellar customer service for individuals who are in crisis and experiencing trauma. We've seen improved coordination and cross-sector connectivity and reduced administrative burden for frontline staff. Thank you again for your time looking at this issue. We really appreciate your leadership and partnership, and are very much in support of this bill.
Quickly means saying I support the bill.
Lisa Ramirez, please unmute and begin your testimony.
Good morning again. I'm confident I do have the right bill this time. So again, I'm Lisa Ramirez with the YMCA of Greater Richmond. We support this bill, strongly support this bill, because we feel that this will help to make a change in our community and will help to promote connected care. We're working in a network with partners that are hospital systems and healthcare districts. We believe that this bill and this work will help to support change for Virginia.
Your testimony. It's been moved and seconded that SJ 42 be reported. All those in favor, please say aye. Aye.
Aye.
Those.
Aye.
Okay. Thank you. Those opposed?
Aye.
Okay. Thank you.
Thank you, Madam Chair and the committee.
Okay, Senator, I lost my list again. Senator Mason and then Senator Stanley.
Thank you, Madam Chair, members of the committee. SJ 14. So, COVID, the pandemic's touched everything we do, including the attendance on our panel today. We've often said we don't staff the Virginia Employment Commission to deal with 1 in every 4 Virginians applying for unemployment, and we don't staff the health departments for a global pandemic. But I don't want us to miss the opportunity to evaluate a lot of things. And so beyond the preamble, down about 46, 47, you see this will look at the current structure, operation and oversight and funding, look at the pandemic response, and then ultimately evaluate that structure, how it stands, how it responded, look at the effectiveness of the structure, and then make recommendations for change. So I asked for this to go to the Commission on Health. I think there are others going to JLARC, but JLARC is generally backed up, stacked up, and jacked up. So I asked for this to go to the Commission on Health, and it, I think, works in conjunction with a lot of the work that they're currently doing and give them some guideposts for the future. So that's a resolution, Madam Chair, and there are no authorized witnesses for my resolution, ma'am.
Are there any questions to Senator Mason?
I have a question.
Senator Peterson.
So I take it that basically what you're looking at, Senator, is kind of how do the local health districts interact with the state and how we divide those responsibilities? Is that basically it?
Madam Chair, Senator Peterson, the whole shebang, the structure, how they're organized, how they interact with the state, how they responded to the pandemic, what was good, what was bad, what was ugly. I want to go forward. How should they be established? The chairman and I are trying to expand the leadership opportunities in them because we have some vacancies and some other, and we believe that we should just give others opportunity beyond doctors, not excluding doctors. So really, it's just in conjunction with looking at the whole structure. I'm not certain how long it's been since we did, but I just don't think we missed this chance to really do a thorough evaluation. We'll probably find some things that have done extraordinarily well because of the structure, because of the makeup. But I think we're going to find a lot of ways we can improve, and I want to take advantage of that.
If I could just make one follow-up comment, Madam Chair.
Senator Peterson.
We, of course, a year ago, almost exactly, we were rolling out the vaccines, and in Fairfax County, we did that through our own Department of Health, versus the state. I actually think both systems work pretty well. I thought Fairfax County did a very good job of getting people vaccinated, and they had a very high vaccination rate. I thought that the state, after some initial stumbles, actually did a pretty good job. I thought Dr. Avula did a fabulous job. I would, recommend him for whatever job he does next in his life. He did a great job, and I thought brought some confidence into that program. So, anyways, I just think that it would be interesting to see kind of. We went through that a year ago, how that study would play out.
No doubt. Madam Chair, Senator Peterson, that'd be a great example because analyzing how your area set up the vaccine clinics and how ours did, ours were really locality driven, worked closely with the health department, but with our major hospital providers. We had a model that worked extraordinarily well with some glitches. And so I'd love to have this do exactly that. Look at how you did it, how it worked, how we did it, how it worked, how Abingdon did it, and how it worked. Thank you, Madam Chair.
Madam Chairman, Senator Favola has a question she would like to ask.
Senator Favola.
Thank you, Madam Chair. I just want to note that this topic area is one of the top study areas that the Joint Commission on Healthcare adopted for its 2022 study year. So this would be right in line with something the Commission already adopted. We have the bandwidth to do it, and I think it's very necessary. Folks are concerned about, sort of the disparities among among different regions in the state in terms of ability to respond to a public health crisis. So I support it.
Okay, we have SJ 14. It's been moved and seconded that SJ 14 be reported. All those in favor, please say aye. Aye. Those opposed? Aye. We have our folks on virtual. Are they voting? Did they vote?
Oh, yeah.
Okay.
We all, aye?
Aye.
Aye.
Okay, SJ 14 is reported. Thank you, Senator.
Thank you, Madam Chair, members.
Senator Stanley.
Morning, Madam Chair. It's great to see you this morning on a Friday. Madam Chair, yeah, indeed. Senate Bill 417 is before you up. Madam Chair, you know I try to offer the most impactful bills possible that will impact the Commonwealth of Virginia, and this is one of those biggies. This is, and I'm glad to be before this committee because this is a study bill, and Senator Sasselaw puts the stud in study, so I know I'm talking to the right people. I'm trying to suck up to you right away. I mean, so thank you. I'm glad you caught that. So basically, together with the Press Association, VML, VACO, they've all come together. They would like the Code Commission to convene a work group to review the requirements throughout the Code of Virginia for localities when they have to provide public notices for intended actions, including the varying frequency for publishing notices in newspapers and other print media, the number of days required to elapse between publications of those notices, and the amount of information required to be contained in those notices. As you know, Madam Chair, members of this committee, we have been dealing with that in local government. Quite frankly, I think if all three parties can get together with the Code Commission, we can find a resolution, especially because we're dealing with print media and online media. We can find a resolution to where we don't have to keep hearing those bills in the same way that Senator Marsden has to keep hearing my dog bills. That's the bill, and I have not either authorized anyone to speak on behalf of this bill.
That's absolutely wonderful. Okay. Are there any questions to Senator Stanley? But I will have to ask, is there anyone here in support of Senate Bill 417?
If you're in the Zoom room and wish to speak in support, please raise your hand electronically.
That's right. Just wave your hands. Thank you. Anyone in opposition?
If you are in the Zoom room and wish to speak in opposition to this bill, please raise your hand electronically now. Madam Chairman, we have no speakers.
Okay. It's been moved and seconded that Senate Bill 417 be reported. Is this recorded? This is a recorded vote.
Senator Howe, how do you vote?
Senator Howe votes aye.
Senator Favola, how do you vote?
I vote aye.
And Senator McPike, how do you vote?
Aye.
Ayes 13, noes 0.
Ayes are 13, noes are 0. Bill's reported.
Thank you, Madam Chair, members of the committee. I appreciate your time.
Thank you, Senator Stanley. We now will go to members. Senator Dietz.
I've got, if I can do it from just right here, that's all right. Senate Joint Resolution 11, it directs the Joint Commission on Health Care to study eating disorders in Virginia from looking at ways to raise awareness and educate to looking at access to care. The difficulty to assess appropriate care for eating disorders is nothing new. The Joint Commission looked at this issue in 1999 and in 2011. Staff noted in 2011 that lack of insurance coverage for certain services was a barrier to care, but the Joint Commission didn't move forward on any policy changes at that time. To my knowledge, there's not been a comprehensive review of this issue since that time. Eating disorders are serious conditions and have the second highest mortality rate of all behavioral health disorders. Anorexia has around a 10% mortality rate. 9% of Virginians will have an eating disorder sometime in their lifetime. And most alarmingly, we saw a dramatic increase in 2020 over prior years in eating disorder diagnoses among people under the age of 30. This bill is basically in response to the dozens of calls I get every year about what we're doing to address eating disorders, and the reality is we're not doing anything. I think we have the information out there, probably from that 2011 study, but I'm just asking that it be updated.
Thank you, Senator Deeds. Are there any questions?
You always done.
Those in support, raise your hands out there. Just wave at me.
Morning, Madam Chair, members of the committee. Jeff Lenardi with the Joint Commission on Healthcare. We're agnostic towards this study. I just wanted to let the committee know, as Senator Favola indicated, our members did direct a full slate of work for this year, and so our members, part of that process was reprioritizing after session. So just wanted to let the committee know that if it's the will of the committee to pass it, we'll work with our members to reprioritize, or if it's referred by letter, we'll work with them to figure out if they want to do it this year or in a future year.
Okay, thank you.
If you are in the Zoom room and wish to speak in support of this bill, please raise your hand electronically now. Madam Chairman, there are no speakers in support.
Any opposition?
If you are in the Zoom room and wish to speak in opposition to this bill, please raise your hand electronically now. Madam Chairman, there are no speakers.
Okay, thank you. We have SJ 11. It's been moved and seconded that SJ 11 be reported. All those in favor, please say aye. Any opposition?
Aye.
Okay, thank you. SJ 11 is reported. Senator Favola.
Madam Chair, I'm going to ask that my bill go by for the week. I don't feel I'm well prepared. The Senate Bill 62.
Okay, thank you. Without any opposition, Senate Bill 62 will go by for the week. Senator Lewis.
Yes, Madam Chair. I've got Senate Joint Resolution 35, and this continues the work of the Joint Subcommittee on Coastal Flooding, which was the product of your legislation several years ago. There is a substitute, Madam Chair, I believe. And I'll just briefly, what the substitute does is
We need to adopt the substitute.
I'm sorry, yes, I'm sorry.
Moved and seconded that we adopt the substitute to SJ 35. All those in favor, please say aye.
Aye.
Those opposed? Okay, we have the substitute.
So, Madam Chair, members of the committee, what the substitute does is it comes at the suggestion of folks outside of coastal Virginia, and you can see by the current name of the joint subcommittee, it's coastal flooding. And so what we've tried to do with all of our resiliency efforts across the board is recognize, particularly with the Community Flood Preparedness Fund, we reconstituted that and made sure it was clear that it applied to statewide flooding and resiliency efforts, not just coastal flooding, river flooding, and so forth, due to these intense storms that we're experiencing. So what that does, changes the name of the committee to make sure that it's just on flooding in general writ large, and also it adds 3 members from different areas of the Commonwealth. So we've sort of broadened our scope, as we've done with other resiliency efforts in that. In all other respects, the mission and the constitution of the study committee remain the same, Madam Chair.
Are there any questions to Senator Lewis on SJ 35? Do we have anyone?
If you are in the Zoom room and wish to speak in support or opposition to this bill, please raise your hand electronically now. Madam Chairman, there are no speakers.
Anyone in opposition?
If you are in the Zoom room and wish to speak in opposition to this bill, please raise your hand electronically now. Madam Chairman, there are no speakers.
Okay.
Second.
It's been moved and seconded that SJ 35 be reported. All those in favor, please say aye.
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 Those opposed? SJ 35 is reported. The 2 remaining bills are mine. SB 151 is the Commission to Study Slavery and Subsequent de jure and de facto racial and economic discrimination against African Americans, which is due to expire on June 30th. What this does is it extends from July 1, 2022 to July 1, 2024. The expiration of the commission. Due to COVID, the commission did not really get started on its work until a year after it was established, and so didn't really get started until a year later. So it really only got started on the work within a year. So I would like to extend the commission's work. It's been moved and seconded that SB 151 be reported. All those in favor, please say aye. Aye.
Aye.
Aye.
It's recorded. Oh, this is a recorded vote, I'm sorry.
Senator Howe, how do you vote?
I vote aye.
Senator Favola, how do you vote?
I vote aye.
Senator McPike, how do you vote?
Aye.
Ayes 13, noes 0.
Okay, and at the request of a member, I am going to pass by for the week SR 13. Okay, so that completes our docket.